Hi, I'm Steve Rowe, Executive Director. Today is Wednesday, December 16th, and it's my turn to provide the weekly update for you. I'm going to start just by giving a brief update on COVID case counts in Johnson County and how we're doing. The slow downward trend is continuing. It's now been almost a full month that we've been on this downward trend, but we're still up above a case count where we would feel comfortable. Most recently, I updated our tracking sheet yesterday morning, and the 14-day daily average as of yesterday was still over 48 new cases per day. So there had been 680 new cases in the previous 2-week period. So still quite a lot of new case activity around us, but that is down from a high point of about 144 new cases per day back in mid-November. So we're definitely headed in the right direction. Hopefully people continue to be safe and careful and stay home as much as possible, and we can keep driving that case count down. The positivity rate for new cases also has been declining, and as of yesterday when we looked, we had gotten under that magic 10% threshold. That is important because it dictates how frequently we are required by regulation to test our staff. So when the case positivity rate or the test positivity rate is more than 10%, we're required to test our staff at least twice a week. When it gets below 10%, we can reduce that testing to once per week. We at Oaknall have chosen to test more frequently in the weeks immediately following Thanksgiving. We have been testing employees 3 times per week. So Monday, Wednesday, and Friday have been testing days. We will continue that this week, and then next week with Christmas being on Friday, we will test only on Monday and Wednesday, but that's still going to be more than is legally required of us. We will do that again the following week, the week of New Year's, at the end of that second week, and then we'll figure out how frequently we need to test going forward after the New Year's holiday. So things are generally headed in the right direction. We tested residents in the health center last week, and we were all negative tests. And of the 50 tests that were done yesterday for our health center residents, we have results on 49 of the 50 as of this moment, and all 49 have been negative. So we're expecting that last one will be negative as well, and then hopefully we won't have to test residents again if we can continue to have all negative tests for our employees. So enough about testing and case counts. I know that many of you have been watching the news, see that the vaccine has been approved and is starting to roll out. I know 2 days ago, the first employee at University Hospital received the vaccine. We were on a Zoom call with Dr. Winokur from the University of Iowa. She is really the lead person at the university related to the Pfizer study for the Pfizer vaccine. And she is really encouraging all of us to get the vaccine as quickly as we can. The challenge is how quickly is it actually available to us. We have done everything we can as an organization to try to get as many doses as possible as quickly as possible. Our belief is that the week of December 28th, we will receive doses for our health center residents. So we'll get 1 dose for each of the licensed health center beds, which would be 58. And then we will get some doses for our staff who work in the health center. We're unclear at this point whether that will be 58 doses for staff or 116 doses, a 2-to-1 ratio or a 1-to-1 ratio. Regardless, it is not enough to cover all of the people who work in the health center. We are currently testing about 160 of our 250 employees. So it's like no matter what happens the week of December 28th, it's not going to be enough to cover all of the people who we would like to vaccinate in this first wave, but that is the first allocation that's coming from the state of Iowa to any nursing facility is that week of December 28th. We have requested that we want to vaccinate all of our assisted living residents and all of our independent living residents as well. I do not know, and nobody knows really when we will have the vaccines available to do that. And I would just encourage you, if you have the opportunity any other way to get vaccinated, to go ahead and do that. My guess is that you won't have the opportunity because like they're obviously working with healthcare personnel first. University Hospitals has their own vaccine. We will receive the vaccine through an arrangement that we have with Walgreens. So for all nursing facilities throughout the country, either Walgreens Pharmacy or CVS Pharmacy is the way that we will receive our vaccines through those organizations. And we're really kind of depending on them to get it to us as quickly as possible. So the week of December 28th will be the first time we believe that we'll be able to start vaccinating any of our residents, and hopefully shortly thereafter there will be opportunity for all of us in the Oaknall community to get vaccinated. It will be a series of 2 shots, either 3 weeks apart or 4 weeks apart, depending on whether it's the Pfizer vaccine or the Moderna vaccine. Easy for me to say, but it's like again, we'll keep you updated, share as much information as we have available to us, but that is what we know today. I want to talk a little bit about our board transitions, our board of directors. This morning was the last board meeting for 2020, and we had 5 retiring board members this morning, and we welcomed 5 new board members to join us for 2021. The 5 members who were retiring this morning, all of them served either a 6-year term with us, 2 consecutive 3-year terms, and in one case, actually a 7th year because this person was a past president of the board of directors. So I just want to publicly thank the outgoing board members. They are Jeff Canfield, so Phyllis Canfield's son. He's done a great job for us, and he's retiring. Pam Ely, Mark Preece, and Mark is the person who served 7 years on our board of directors because this was his 7th year and he was able to serve as past president for 1 additional year. Mary Westbrook and Dr. Rod Zittler. So if you see any of those people or talk with them routinely, please thank them for all of their service to the Oaknall community. It's very, very much appreciated. And the 5 new board members who we welcomed this morning are Tom Bender. Tom's mother and grandmother both lived at Oaknall, and his mother-in-law currently lives at Oaknall. Jeanette Hall is a banker. She works at Midwest One Bank. John McKinstry is a retired pastor. Dr. Peter Caboli and Melvin Shaw is a local attorney. So those 5 new faces will be working with the Oaknall community over hopefully the next 6 years in a governance role for us. Finally, I want to, it's kind of a short message, I believe, but it's like the last thing I want to do is thank you for all of your incredibly generous contributions to the Holiday Gift Fund. I don't want to spill the beans and tell you what the amount per person is yet, but I can tell you that for the 20th consecutive year, we set a new record. You set a new record for how generous you have been to our employees. This has been an incredibly challenging year, and we thank you so much for your generosity. Last year, you contributed $156,000 to that Holiday Gift Fund, which was distributed to all of our employees, and a full-time person share last year was about $880, if I remember correctly. This year, the total contributions that we've received exceed $182,000. So just again, we so thank you for your generosity. It is just absolutely amazing and humbling to see your reaction to this annual appeal and gift to our employees. That gift will be distributed to our employees Friday afternoon. So there will be a letter in your mailboxes probably late Friday afternoon to tell you what that equated to for a full-time employee share. But all of our employees who have worked with us since basically mid-November will receive a portion of that, and we split it up based on how long somebody has worked and how many hours they've worked for us. So try to be fair and equitable, but everybody will receive a very, very generous holiday gift from you. So thank you so much. Happy Hanukkah, Merry Christmas, Happy Holidays.